And that's where we begin this evening with the very latest on that deadly Navy Yard attack in Washington, D.C. Good evening. I'm Gina Gaston.
Good evening, everyone. I'm Art Rascone in for Dave Ward tonight. There are still so many unanswered questions, but Eyewitness News reporter Katie McCall now live with more on how professionals profile these kinds of suspects. A serious question, Katie.
It certainly is, Art, and very relevant today. While these mass shootings always seem to come out of nowhere, there are usually warning signs when it comes to the people who are suspected of carrying out the crimes. This case is no different. In fact, in just a few hours, a profile of alleged gunman Aaron Alexis is emerging that a local psychiatrist said contains many red flags.
Very little is known about suspected Navy Yard shooter 36-year-old Aaron Alexis, but a May 2004 incident in which Seattle police records say Alexis shot the tires of a construction worker's car because he was angry over it being parked by a home where he was staying is starting to paint a picture of the alleged gunman. Houston psychiatrist Dr. Daniela White says there are certain mass shooters tend to have in common.
Most of them build anger and resentment under a lot of stress.
This personality type has a low threshold for perceived wrongs, so if there is a life-changing event such as the end of military service or a change in employment, that can trigger a violent act.
They really take it like a personal injury to self-confidence, and they cannot move that. So as a result, they build a lot of anger.
We know that Alexis served in the Navy and is believed to have worked recently as a contractor. His reason for detachment from naval service is another unknown.
Usually they build a pattern of difficulties maintaining relationships, for example, or they have a pattern of irritability sometimes and very quick respond to relationship injuries or conflicts.
In order to complete a mass murder, White says a high level of detachment is required. It is usually someone with an antisocial personality disorder or similar diagnosis who feels no empathy for others and can only see how he or she has been harmed.
All they can think about is how to get back at the person who imaginarily produced an injury to them.
And Dr. White says there are sometimes threats made prior to these shootings, but usually these are secret and well-planned attacks that are in the works for months or weeks ahead of time. Katie McCall, 13 Eyewitness News.